There might not be much of financial benefit, but then the suffering which millions of such people undergo, and you have brought about this kind of global initiative, first of its kind in our country, and which is going to be produced all around the world.
This subject, which was largely neglected globally, not only in India, has taken lead, and I have no doubt that we are going to surpass any such effort anywhere in the world.
This is quite a problematic condition for the women who suffer from this, because it affects their quality of life to such an extent that sometimes they even have developed suicidal tendencies. It can be that severe a problem.
I want to emphasize on importance of avoidance of unnecessary use of antibiotics, which are not definitely going to help the patient. Avoid unnecessary surgical interventions.
Many of times these patients, they don't know actually where to go. They've been treated for urinary infections by so many doctors, the general practitioners, gynecologists, and sometimes even by urologists. Even though there's no evidence of infection, they go on taking these antibiotics, and finally when they don't find any relief, they keep on changing the consultants. And now we know that apart from infections, these symptoms can be caused by a syndrome known as bladder pain syndrome, or which previously was known as interstitial cystitis.
It is only the tip of the iceberg that we are seeing. There are a lot many patients who have the chronic interstitial cystitis disease. Instead of sending them to the psychiatrist, I think we should be treating them ourselves.
I'm in a teaching institution. Just 2 days back, before coming for the flight, I had a class from 8 to 9, and I thought, let this be the topic of my class so that I get warmed up for the session. And I taught the MBBS students about this interstitial cystitis and bladder pain syndrome.
I invite like-minded people, my colleagues, both gynecologists and urologists, as well as urogynecologists, to be part of this GIBS, so that we can all together go forward from here and help these women who really suffer in silence.
Swati Spentose Private Limited happens to be a benchmark in spreading awareness for this disease, interstitial cystitis bladder pain syndrome. I'm amazed at the level of scientific content that Swati Spentose at this point of time has in its pedigree over the last 10 years of research on the subject and the molecule, right from the basic molecular stage to getting into the therapeutic range of medicines that would help patients who suffer from this disease. Dream of SSPL to make their awareness drive, which they have dreamt for the race at this point in time, and to probably abolish the disease called interstitial cystitis, look at saving the bladder from becoming an end-stage bladder.